Dissanayake, Senior Registrar working at Teaching Hospital Peradeniya. I am going to talk about heart injuries, which is a commonly encountered surgical problem in surgical casualties. So first of all, I'll describe my objectives. So you should be able to discuss definition and the importance of heart injuries. Then you should be able to classify heart injuries. Then we should know about the presentation and how to work up. And lastly, the management of heart injuries. So what is the definition of heart injury? So first of all, can you hands up for the people directly involved in heart injury management? Can you raise your hands? There are a lot. Thank you very much. So what is the definition basically? So there is a linear breach of the skin, as well as there can be involvement of underlying tissues. So what is the importance of discussing this? Do you have any idea? So this can be just a small matter, or it can be associated with mild or severe morbidity, and sometimes it can be lethal, isn't it? So how can we classify heart injuries? So there can be heart injuries in any side of body. So we can discuss about anatomy of the heart injury. Then the depth of involvement can be superficial or it can be deep. Then degree of contamination, that is association of infections with heart injuries. Then the mechanism of heart injury and the weapon, and maybe the injurious agent. So mechanism, it can be low velocity or it can be something as shrapnels, high velocity. So presentation, it can be following a traffic accident, assault, self-inflicted heart injuries are common, and other accidents, falling and things. So they may complain, there may be basic complaints, pain and bleeding, and there can be specific complaints. So we can assess this according to ABCD approach, that is airway, breathing, circulation, and other deformities. By that approach, we can assess this. Examination, we have to assess the site. So there are two main governing things, that is site, depth, and the involvement of distal organs. There again, it's good to assess according to ABCD approach, because as an example, if it's a heart injury in throat, there can be airway compression. If it's a heart injury in thorax, that may impair breathing and ventilation. And there can be circular effects if we cut large arteries. So investigations, sometimes small cuts, maybe none. We may just use some local anesthesia and explore. And heart injuries in limbs, maybe just exploration is enough. And if there are underlying tissue damage, yes, we can repair. But when this involves body cavities, we may go for further investigations, maybe X-rays to see pneumothoraxes, as example in chest injuries, and maybe ultrasound scans, fast scans, and even computed tomography or MRI scans when it's available in abdominal injury, as example. And sometimes with the contamination, especially we may go into preliminary blood investigations just to see inflammation and the infection associated. So my last slide will describe how to manage this. So always we have to go with the acute management and resuscitation according to ATLS ABCD protocols, and maybe depend on the site. Then there will be decontamination, usually by surgical decontamination. Then restoration, we have to repair. If it's a limb, we may repair tendons, we may repair nerves, and if it's in abdomen, we may repair even bone. Then always it associated with rehabilitation. So if it's a nerve injury, and we may have to give limb physiotherapy. So if it's a chest injury, we may do breathing exercises. Like that, rehabilitation has a part. Then, of course, we have to tackle medical legal problems. So these are medical legal things, and we have to document it well, and we have to do necessary referrals for JMOs and institutes. So that's it, and it's time for questions. If you have any questions, that's very helpful. So I think you are not doing of managing of this, so you may have any questions. Come up.
Shrapnel injuries you mentioned, do they come under cut injuries to manual laceration?
That depends. If the shrapnel is sharp, it may be a cut. So definition is linear. But if it has distorted margins, we may consider it as a laceration. Okay, thank you very much. So I would like to sum up. So cut injury is a linear breach of skin and can have multiple degree of deep tissue involvement and can have consequences of mild to lethal complications. And we should manage accordingly, mainly according to site, as well as we should assess and manage according to NTLS protocols. That's with ABCD approach. Thank you very much.
This presentation also, there's a particular structure, well-organized structure is there, and at times you use the hand movements and body language well, and I try to get the audience engaged by asking questions. The same area for improvement related to how to write the objectives with a clear specific keyword, that is important, that's something that's important. And also when you try to get the audience engaged, there are challenging situations. So you ask the question, because usually when you ask are there any questions, generally there is no response. That is very challenging. That is why before somebody this question part is put in, that's purposely put in, because at the end of the lecture, when you ask are there any questions and nobody asks questions, you are in a very awkward situation. So in this way, before summarizing, we ask, okay, before we summarize, before we conclude the session, are there any clarifications? So the challenging thing is, usually they don't ask questions. So maybe you give some kind of maybe a prop or something that will encourage them to ask questions. So you can word that part more into the question session, that the participants will be encouraged to ask questions. So there are many different techniques that you can use. Regarding hand movements, you are keeping your hand like this for some lot of time. Because the hand movements are also important. True that, I mean, you can't be like a politician and waving your hands all over the place. Generally what we tell is it has to be within the line of your body, but you can use your hand movements in different ways to convey the message. For example, if someone is saying increasing, you can do like that. But your hand your body language and hand movement should be compatible with the message that you want to give. For example, if you say there are 4 types of cut injuries, then you are getting a confusing message. Okay? If you do like that, that will enhance. Okay? Or the road traffic accidents in Sri Lanka are increasing, but you do like that. So there are ways you have to really plan that section. That is the challenging thing that has to do. You have to really plan. Okay. So those are some of the areas that I know that as areas for improvement. What about others?
I thought to ask questions, if we have been more time for the audience to answer, we would have come out with some
answers. Because that is very correct. When you ask a question, it's very uncomfortable to bear that silence. Okay. But if you have the courage to tolerate that silence, someone will speak up. That's the secret. After asking the question, it's very difficult. Because it's very difficult to tolerate, then you yourself can't answer. But if you can wait for few minutes and see who wins, generally it will be the students who will be coming up with the question or the answer.
The timing and keeping the interactive way of discussing and lecturing throughout the lecture is a challenge. So, you know, in NTMC, there will be a board showing you 10 minutes behind. Then you will get hurry to finish the next set of slides. and then we will show the 5 minutes. Then you will stop asking questions, you will rush on. Now you started with asking hands up, and after that you continue your teaching.
This is it. Yeah. Yeah.
So
Yeah.
to overcome that, but we practice sometimes. Initially, we will ask you questions and get the interactive way, and then go ahead with your explanation and description with the slides, and then come to another set of questions or interaction at the end. Then you keep the arousal part of the lecture throughout. Right? So if you, at the beginning, if you get set with all these things, by the 10 minutes is there. If you get excited, very difficult to come up. So just to, I mean, that is what is happening to us most of the time. Right? Okay.
Right. Okay.